I'm Hamida Ismail Mauto, and I work for Sexual Reproductive Health Africa Trust. And on the abortion agenda, we are currently supported by Amplify Change. And the strides that we've made towards the abortion agenda, we've managed to do a mapping exercise where we were trying to identify who are the civil society organizations who are actually working on issues around abortion in Zimbabwe. And we mapped those organizations and we invited those organizations to join the Safe Abortion Coalition so that we can have one voice and we can advocate together as a coalition as opposed to working in silos.
So for the last 2 days, the Safe Abortion Coalition has been having discussions around enhancing access to safe abortion for women and girls in Zimbabwe. And one of the key things that's been raised is the existence of significant administrative barriers within the Termination of Pregnancy Act, which limits the access for women that are legally entitled to accessing safe abortion. And really our conversations have been around what needs to be done at community level to increase the knowledge levels of women and girls in those communities, as well as local leadership, to ensure that those women who are either raped or victims of incest will also have a risk of physical impairment or risk of physical impairment to the fetus are allowed the access that they should be getting. At present, the process of acquiring a legal abortion is cumbersome because of the structure and the non-regulation of that access. And the ripple effect of this is that a lot of women who should be going through the system legally then fall out and access these services in unsafe conditions. And the ripple effect of this is that a lot of these women then come back to the public healthcare system seeking post-abortal care, and what this results in is a heavy burden on our already struggling healthcare system. And a lot of these issues are really compounded by the fact that the knowledge levels are low.
So the current status of the coalition is that we worked together to develop a TOP model law, which we are trying to use as an advocacy vehicle for us to be able to lobby and influence policy changes or the review of the Termination of the Pregnancy Act and get parliamentarians to be our allies so that we are able to expand the termination of pregnancy in Zimbabwe. And I just want to mention that the coalition is working very well. So we've managed to bring key civil societies together to actually then consolidate our efforts and come up with strategies to engage both parliamentarians, the executive for the Ministry of Health and Childcare, and the Ministry of Justice and Parliamentary Affairs.
And so, collectively as the coalition, we realized the need to also ensure that there's advocacy at grassroots level to ensure that uptake and access to safe abortion is regularized and it's done in a safe method.